7 million Americans have a hand tremor right now. Most of them are terrified they have Parkinson's disease. Here is the truth. 9 out of 10 shaking hands have nothing to do with Parkinson, not even close. That fear you carry every time your coffee cup wobbles, it is probably stealing years of peace from you for no reason. And the silence around it, the not asking, is the worst part of all. I'm Dr. Rosalind Keller, 36 years in family medicine. I don't sell supplements. I don't run a clinic anymore. I'm here because someone should tell you what your doctor doesn't have time to. Subscribe so you never miss a conversation like this one. Picture this. You are sitting at the kitchen table. Your grandchild asks you to sign a birthday card. You pick up the pen. Your hand starts to shake. The letters come out wobbly. You feel embarrassed. You pull your hand back and say your wrist is sore. Later, you pick up a glass of water. It trembles on the way to your mouth. A little water spills on your shirt. You laugh it off. But inside, you are scared. You go to your computer and type hand shaking into a search bar. The first result says Parkinson. Your stomach drops. You close the laptop. You never mention it to anyone. I saw this exact story hundreds of times over 36 years, and almost every time the answer was not Parkinson. The most common cause of hand tremor in adults over 60 is something called essential tremor. It affects 7 million Americans, that is 10 times more people than Parkinson, yet most people have never even heard of it. Here is the myth I need to destroy right now. Many people believe any tremor means Parkinson's disease. That is simply wrong. Essential tremor and Parkinson tremor are two completely different things. They look different. They act different. They come from different parts of the brain. Let me explain this in simple terms. Think of your brain like a building with many rooms. In one room, there is a volume knob that controls your movements. Essential tremor happens when that volume knob gets turned up too high. Your movements become amplified. So when you reach for something, the shaking starts. When you write, the shaking starts. When you lift a cup, the shaking starts. The tremor happens during action. Now, Parkinson tremor comes from a completely different room in the building. This room makes a chemical called dopamine. When the dopamine factory slows down, strange things happen. Your hand shakes when it is doing nothing at all. You are sitting in a chair watching television. Your hand is resting on your lap, and it starts to tremble. The shaking stops when you reach for the remote. That is the opposite of essential tremor. Essential tremor shakes when you move. Parkinson tremor shakes when you are still. There is another big difference. Essential tremor usually shows up in both hands at the same time. Parkinson almost always starts on just one side of the body. One hand, one foot, one arm. Before we go further, I need you to hear this. If you have any of the following, stop and call your doctor before changing anything I described today. Kidney disease of any stage, liver disease or cirrhosis, diabetes treated with insulin. You take blood thinners like Eliquis or warfarin. You take a diuretic. You take a proton pump inhibitor like omeprazole. You have uncontrolled high blood pressure. This video is education. It is not personal medical advice. Nothing replaces a doctor who knows your chart. Now, with that said, here is what the research shows. I want to tell you about a woman named Dorothy Saunders. Dorothy was 74 years old when her daughter brought her to my office. Dorothy had been shaking for 3 years. She had not told a single person, not her husband, not her best friend. She wore long sleeves to hide her arms. She stopped going to her church group because they passed around a collection plate, and she was afraid people would see her hand shake. Dorothy was convinced she had Parkinson. She had already read about the disease online. She had already started grieving the life she thought she was about to lose. When I examined Dorothy, I asked her to sit with her hands in her lap. They were perfectly still, no shaking at all. Then I asked her to hold her arms out in front of her. Both hands started to tremble. I asked her to touch her nose with her finger. The shaking got worse as her finger got closer. I asked her to pour water from a pitcher into a glass. She spilled some, but she had been doing that for years. I told Dorothy she had essential tremor, not Parkinson. She stared at me for 10 seconds. Then she cried. She told me those were the best words she had heard in 3 years. Here is a test you can do right now. I call it the cup test. Get a plastic cup and fill it halfway with water. Hold it in one hand with your arm extended in front of you. Watch the surface of the water. If the water ripples and your hand shakes while you hold it out, that suggests an action tremor. Now set the cup down. Place your hand flat on your lap. Wait 30 seconds. If your hand is still and calm on your lap, that is another sign pointing toward essential tremor, not Parkinson. Parkinson tremor would show up right there, while your hand is resting. Remember, this is not a diagnosis. Only your doctor can diagnose you. But this gives you something to talk about at your next visit. Here is a second test. Get a piece of plain white paper and a pen. Draw a spiral. Start from the center and work your way out. Make the spiral about the size of your palm. Now look at it. If the lines are wavy and wobbly but they stay on track, that is common with essential tremor. If the lines are very small and cramped, that can point more toward Parkinson. You can also draw a straight line between 2 dots about 4 inches apart. A shaky but visible line suggests essential tremor. A very tiny, scratchy line with barely any movement suggests something else. Bring both drawings to your next doctor visit. They are genuinely useful. There are a few things that make essential tremor worse. First, caffeine. Coffee, tea, energy drinks, and even chocolate can turn up the volume on your tremor. If you notice more shaking after your morning coffee, try cutting back for 2 weeks and see what happens. Second, stress and anxiety. When your body floods with adrenaline, your tremor gets louder. This is why your hand shakes more when someone is watching you write. Third, certain medications. Albuterol inhalers for asthma, some antidepressants, and lithium can all increase tremor. Do not stop any medication without talking to your doctor first. Fourth, lack of sleep. Fatigue makes your nervous system jumpy. Poor sleep almost always makes a tremor more noticeable. Now, here are things that can help. First, magnesium-rich foods. Spinach, almonds, black beans, and bananas all contain magnesium. Magnesium helps calm nerve signals. You can find all of these at any grocery store. Second, omega-3 fatty acids. Salmon, sardines, walnuts, and flaxseed support healthy nerve function. Aim for 2 servings of fatty fish per week. Third, foods rich in B vitamins. Eggs, chicken, and fortified cereals give your nervous system the fuel it needs. A B12 deficiency alone can cause tremor, and it is very common after age 60. Fourth, staying hydrated. Dehydration makes tremor worse. Keep a water bottle nearby and sip throughout the day. Aim for 6 to 8 glasses. I call this the Keller Tremor Protocol. Step 1 is called track. For 2 weeks, write down when your tremor is worse and when it is better. Note what you ate, how you slept, and how stressed you felt. Patterns will appear. Step 2 is called test. Bring your tracking notes, your spiral drawing, and your cup test observations to your doctor. Ask specifically about essential tremor. Ask for a neurological exam. If your doctor is unsure, ask for a referral to a neurologist. A proper diagnosis changes everything. Step 3 is called tame. Once you have a diagnosis, work with your doctor on a plan. This might include reducing caffeine, adjusting medications, starting a gentle hand exercise program, or in some cases, trying a prescription like propranolol. Many people with essential tremor live full, active lives with small adjustments. Dorothy Saunders came back to see me 6 months later. She had cut her coffee down to 1 cup a day. She had started eating more fish and leafy greens. Her tremor was still there, but it was softer. More importantly, she had gone back to her church group. She passed the collection plate with a steady hand. She told me she got her life back. I want to hear from you. Have you been worried about a tremor? Have you been too afraid to ask your doctor about it? Write your age below and tell me how long you have been dealing with this. Your comment might be the reason someone else finally makes that appointment. Here are your 5 steps. 1. Learn the difference. Action tremor points to essential tremor. Resting tremor points to Parkinson. 2. Do the cup test and spiral test at home. 3. Track your tremor for 2 weeks, including diet, sleep, and stress. 4. Bring your notes and drawings to your doctor and ask about essential tremor by name. 5. Reduce caffeine, eat magnesium-rich foods, and follow the Keller Tremor Protocol. This is the conversation your appointment never had time for. The question you wrote down and then crossed out in the waiting room. I don't sell anything. I don't have a practice. I profit from you not needing me. You deserve answers without embarrassment. I'll see you in the next one.